Well, good afternoon, everybody.
Hello, hello.
So do I need to unmute? Hello.
Hey, hey.
How are you?
Good, how are you doing?
Fantastic. So if you'd like to unmute yourself right now before we actually jump into the presentation, just to say hi, we welcome you to do that. For those that don't know me, I'm Tara Carroll, President and CEO of the North Augusta Chamber, and we are excited to have you all on for our Zoom presentation with Isaac. We're going to give a few more folks a chance to get in here, and we'll get started in just a moment. And if you will go to speaker view, that way we'll ensure that you're able to see the presentation for today. Okay. All right, I think we'll go ahead and get going. We've got quite a bit of information, so we'll let folks in as we continue. Again, thank you all for joining us on this call today. We have with us Isaac Kelly, who is Vice President. Oh, I gotta let Cindy in first before I jump on to Isaac. Gotta let Cindy in first. So we have Isaac Kelly, who is Vice President at Augusta Staffing, and he has been so gracious to provide us some necessary information to help us get through this COVID-19, all of the changes that are happening in our community with our businesses. And thanks, I just wanted to say thank you, Isaac, for being the expert for us today, and look forward to hearing whatever information you have to share. So at this time, I'll turn it over to you. But if everyone could go to speaker view, so you'll be able to view Isaac's presentation. And Isaac, do you want to answer questions as we go through, or would you like to hold until the end of the presentation?
We can answer questions as we go through.
Okay, so if y'all would just mute your screens, but raise your hand, and then we'll call on you from there, okay? All right, take it away, Isaac.
Perfect. Well, thank you very much, Tara. Thank you, everybody, for taking the time out of your day to join us today. Like she said, my name is Isaac Kelly. I'm with Augusta Staffing, Aiken Staffing, and Job Shop. We are the trio of employment experts since 1979. Been a member of the North Augusta Chamber for a long time. I enjoyed working with Tara for a long time now, even before she came to North Augusta. And wanted to thank her also for the opportunity to be able to get in front of everyone today. We talked about this a couple of weeks ago, and if you were on the North Augusta morning call, we said that it was going to be last Thursday, but then we had thunderstorms come through, so we decided, since I was going to be at home at the time, that I wasn't going to do it back then on Thursday. But I'm glad that everybody was able to join us today. We're going to get through this. I'm going to show the agenda real quick, but before we do that, I got to give a disclaimer. I need to let you guys know that I am not a lawyer. I cannot give legal advice. And this is a collective information of what I've done professionally to keep our businesses in compliance, as well as what we've learned along the way. So definitely want to refer to your lawyer and your employment lawyer if you do want to compose different things, or like policies or anything like that, or talk to your CPAs if we're talking about tax or any finance. So just wanted to give that quick disclaimer. Through the agenda today, we're going to go through the what we're doing today to manage our business in the now. We're going to touch on the FFCRA, the Families First Coronavirus Response Act, and just touching on that because there's a few things that a lot of people are getting wrong. We're kind of coaching our clients on some of those steps and what's required and how to handle certain situations. So I'm not going to give a very detailed explanation of any of that, but I do want to touch on some things that some people are getting wrong or misunderstanding. And also there's updates every day almost from the Department of Labor on that. Also for OSHA, guidelines on how the general duty active clause comes in, but also the wearing masks in the workplace, how to handle that. If you're requiring your employees to wear masks or to use other PPE, how does that look and how does that work within OSHA guidelines? Employee protections, other things such as EEOC, and then we're also going to get into screening and testing and what's allowed and why are you allowed to do it now. Part 2 is weathering the storm. What if you didn't get your SBA loan? If you did, that's fantastic. But if you didn't, and there's a lot of us out there that didn't, what else? What other options are there? What else can we do? So I've kind of collected a few things that I'm helping my clients with, but I'm also collected a few things that I've heard from other business partners around the area and across the nation that what they're doing. So we're also going to talk about employees. We're talking about relaxation of some of the federal taxes, sales, how we're handling that, but also what my personal and professional recommendation would be. But also collections and cash receivables, talking about how we keep the business afloat. Reductions of salaries, what can we do? And also over communication with our employees. Then we're going to wrap it up with working environment policies to consider going forward, because this is not going away anytime soon. We also want to touch on a couple of things that we're all adapting to. One of these is Zoom calls, as we're on one now. But Zoom calls and new apps that are helping us continue our business and our service to our clients. And some of the things that we're using in-house to keep in touch with everyone. So first off, I'm going to kick it off with a poll. And if you want to get your cell phone out and text Isaac K633 to the number of 22333, or you can just go to the address there. And don't know if I could put that in the chat, Tara, or not.
You should be, excuse me, you should be able to.
Be able to, okay. But it's probably easy just to text. But if you also want to, if you're on your computer and you have multiple screens or whatnot, you could use the web address as well. Okay, so it's at the top of the screen if you didn't get a chance to get into the website, or if you didn't get a chance to text, but go ahead and I'm just gonna and this is just to test it out to make sure everybody's on, but using only one word, what's your most common emotion felt with the coronavirus? Let's see if it works. If it works, we're gonna get some word cloud going. Oops. There we go. Had to reset. Worried, overwhelmed, exhausting, frustration, worry, anxiety, yes, anxious. Anxiety is getting a lot. Blah. Misinformed. Yes. What was right last week is now not right. Okay. I don't know if anybody's having issues with that, you can keep going, but we're going to get to the first real question. Just so I know who the audience is here, I wanted to know if you can type, and you've already texted, so if you already texted, then all you got to do is do A, B, or C. And I just want to see the size of companies that we have on the call today. So if you have 20 or less employees, hit A and send that text, B or C. Oh, hold on just a minute. I'm sorry. There we go. Keep going. Okay, so we got a lot of small businesses here. 20 or less. Okay, looks like the responses have stopped coming in. So let's go ahead and go to the next question. Let me clear that out. Okay. All right, and if you could just go ahead and answer this one, which best defines your business? Professional services, like B2B, like I would be a professional service since I service my client companies. Consumer services, home repair, salons, gyms, tax professionals, food and beverage, just because you guys are being treated differently through this whole COVID thing. And then public or municipal, if you work for the city or parks or any utilities. Okay. A lot of professional services, B2B businesses in here. Okay. All right, one last question. Let me go ahead and activate this one. There we go. All right. Are you open for business? A, B, or C? A is yes, we're fully operating with doors open with regular hours. B is yes, but we've modified business operations as in a closed lobby or working from home, or some are working from home, or some are working in the office to limit numbers. And also no, we're currently closed and waiting to reopen. This gives me a good idea of where we are in the process. Okay, everybody get a chance to respond? All right, so a lot of you are modified business operations, either closed lobby or teleworking, something other than fully open. And then we've got a few in there, a couple that are actually fully operating. Okay. All right, so this is gonna be information overload. You will get a copy of these, and I believe Tara is recording this for you. So don't try to take too many notes or anything else like that. Just try to, and it is going to be recorded. So, but if there's anything that I say, obviously it'll be on the video when Tara sends out the summary. So it is going to be a little bit of information overload, but hopefully we'll get through it. All right, so part one is going to be managing and compliance. What are we going to do today to where we can not be burned by the alphabet soup? And when I say the alphabet soup, I'm talking EEOC, OSHA, ADEA, for age discrimination, all kinds of things like that, things that we need to keep in mind while we're going through this pandemic. First up, like I said earlier, we're going to touch on the FFCRA, the Families First Coronavirus Response Act. It's given guidance by the Department of Labor, United States Wage and Hour Division. They're giving a lot of, and that's where everybody's going now, is the DOL website that will give us examples and walkthroughs and FAQs for how to handle certain situations. There's currently 89 answers on that website now. So the first things first on this is, it's obviously, you know the synopsis of this by now. The news has talked about it. Everybody else has done webinars on it. It's April 1st through the end of the year. So it's important to know that anything that we talk about with the Families First or the tax and anything that's CARES or FFCRA has been extended to the end of this year, the calendar year, till December 31st. They've established an emergency paid sick leave, and they've enhanced and expanded the FMLA. The paid sick leave we'll go into in just a minute, and also the FMLA, but paid sick leave is new because that was never a requirement of certain employees. And based on what I read on the poll, we've got a lot of employees here that have never had to offer FMLA, and you still may not. We've only had a couple of companies that were actually going to be eligible for this or applicable, because it is said that 50 or less employees, you may be exempt, but we're going to talk about that too as well. All right, so everybody that has applicable employers, as you know, 500 or less employees, there are exemptions for those that have 50 or less, but we're going to talk about the parameters of that. And then also employees, how they meet the requirements. And that's where everybody's getting, or a lot of people that I'm talking to, that's where they get hung up on, like, does this qualify or does this qualify? Or you know, well, I didn't give them this because it was not a doctor's note from here or something along those lines. But that's where a lot of employers are getting hung up on it. And as I'm talking to my clients and handling their, not only our assigned employees, but also their permanent employees, that's how we're kind of getting through it, is we're just checking balances and making sure that we're offering the help where we can. There's also the documentation part, you know, documenting into the employee HR record. How do we handle that? I'm going to get into that a little bit later, into where the EEOC comes in play, and also your HIPAA and your private health information. All right, so let's go through the qualified reasons real quick. And so just to be clear, this is the subject to the federal, state, or local quarantine. Shelter in place is listed on this. So if we have any Georgia companies, the shelter in place that was in place until tomorrow, that did not qualify you for the emergency paid sick leave. So this one is kind of a shot in the dark because no one qualifies for this yet. It's very thin line for those that do qualify, because you'd have to be working in a separate area, or your place of employment would have to be in a separate area, that either one of the parties, you or the employee or the employer, was on a lockdown, a shelter in place, and you were not able to go to, like, say, North Carolina was stopping people from driving into the state unless you had a North Carolina driver's license. If you were to cross the river or cross that border, North Carolina, South Carolina, you would have issues because that would be shelter in place for North Carolina, but also South Carolina residents couldn't get in because of their driver's license. Different things like that. Not a lot of that in the local area because Georgia did shelter in place, but a lot of the employees were able to transport. So that's why this one does not really catch a lot of this one doesn't qualify a lot of people. The second one is actually been advised by a healthcare provider to self-quarantine. Now, this one is dealing directly with your employee. If your employee has sought out medical attention and has been given directive by a healthcare provider in writing that they can share with you, that qualifies them for this reason here. The second reason, or that's employee related directly, is the employee is experiencing COVID symptoms but is seeking medical diagnosis. So they've self-diagnosed basically to this point. you are able to give them emergency paid sick leave until they are able to get medical attention. So those two are to do with the employee only. Then you branch it out to the employee's family, their spouse, their loved ones, their children, dependents. If your employee is caring for an individual subject, I've already had several of these. I've also had employees file for emergency paid sick leave because they have been advised by healthcare providers. But also I've had several of these where their spouses were told to self-quarantine, and that as the spouse caring for that individual who was self-quarantined by medical directive, they're actually eligible for the emergency paid sick leave. The other one is caring for a child whose school or place of care is closed. Now this one, the child care is closed, it's not available. On this one, we've been requiring for our employees to give it to us in writing who their child care provider was, even if it was a family member, because that's qualified too as well. If grandma was looking after, one of the children and grandma was no longer available due to whatever reason, maybe just because she wanted to stay home and self-quarantine just out of, an abundance of caution, then that would actually qualify for a child whose school or place of care or care provider is no longer available due to COVID-19. Now, on this one, we've been requiring documentation from the employee. Sometimes that's just as simple as an email with the details, child's name, the school, obviously everybody's school's closed, but the child care provider, whether it be a daycare or grandmother or family member or neighbor across the street that's no longer available. Whatever the circumstances were, we just get them to document that, and then they share that with us on email, and then we can go ahead and get that started for them. The other one is the experiencing any other substantially similar condition. Now, they threw this in here because they didn't want to have to go back through and rewrite the law. So basically, you've got the first one that's already out. The last one is just going to cover it as a catch-all. If anything new comes out that is also proven to be a need to be part of this list, they will actually include that. That's the only reason they have that last one in there. So really the only ones you need to look at is the first two, which is going to be specific to the employee, or the 2 and 3, and then also 4 and 5. So these are the ones that are going to be exercised the most. Like I said, the shelter in place does not automatically qualify you for reason number 1. Shelter in place or any other situation like that, whether we had a South Carolina work from home or work in home situation, that did not qualify for number 1. So if any employees are asking or will ask about that, that is not no longer, it was never actually part of the emergency paid leave. And of course, if you have any questions as we're going, just raise your hand and Tara will stop me in my tracks here. So, but this is the basics right here. That's the ones that we need to focus on. So there's 2 different kinds of emergency paid leave. There's emergency paid sick leave, which is the new one. That we've never had mandated paid sick leave within the parameters of our laws. The emergency paid sick leave is covering all of the reasons. It's important to know that the emergency paid sick leave is the one that's going to be for 2 weeks for up to 80 hours, 10 days of work. And the emergency paid sick leave can be approved for any of these reasons. The emergency family medical leave expansion is only qualified if their care or is the child care provider is no longer available. So that reason alone, number 5, is the only reason that the FMLA expansion is going to kick in. And we made this mistake in the very beginning when the guidance came out, and we had to wait until DOL kind of caught up because we thought that we were going to have to roll everybody over to FMLA or the emergency FMLA once they got done with the 2 weeks if they were still being directed by their healthcare provider to stay home and self-quarantine. And this was not the issue. So that's where a lot of the clients were getting some of this confused too as well. I'd say a lot of clients, but maybe a handful here that we've kind of coached is that FMLA, because now we're getting into that week now. So if you were on this on April 1st, you're now getting into the payroll periods of that 3rd week or after the emergency paid sick leave has taken place. And so we're getting into this now. We just had our first payroll week where we had the FMLA expansion, but it's strictly for those with the child care. So let's just take a look at these two things very differently. Emergency paid sick leave, the only requirement is that the employee has worked there for 1 day. The employer pays 100% for reasons 1 through 3. So in other words, if it's due to the employee or if it's employee related, they are directed to stay home or self-quarantine, or they are seeking medical determination, basically to determine if they're COVID-19 related or not, and they are experiencing the symptoms, that would be 100% of the employee's pay rate. So if they make $15 an hour, they get paid $15 an hour at the emergency paid sick leave rate. The employer pays 2/3 of the pay rate or minimum wage if for reasons 4 through 6. So if it's not employee related and if it's due to their spouse being given directive or their children or the child care part, it's 2/3 of the employee's pay. Now keep in mind, if you have employees that make $10 an hour, 2/3 of their pay is less than $7.25. So one thing that we had that we caught early was that some of those were making $10 an hour. If you do the math, 2/3 is like 6 and some change. So you got to bump it up to minimum wage. You cannot pay below minimum wage. So that's why it's saying whichever is greater. Now the minimum wage matches for both of our states to federal. So that's $7.25 an hour. The pay is for the length of 80 hours. It's based on 14 days of the CDC guidelines off the bat. So that's what the law was written off of. The medical provider has to write out for the period of time that they are to self-quarantine. If we've gotten any documentation from employees saying that this person has been directed to self-quarantine and there's no time limit on it, or there's no day to return to work, as long as they are not showing symptoms or as long as they are fever-free after a certain period. I don't know if anybody's had to experience that yet, but if you do, make sure that that release or that directive from that medical provider tells you how long they're supposed to be out. If it's just they've been exposed, and I'll give you an example. If they've just been exposed, then usually it's 7 days. And that's what we've seen in our experience here, is usually it's going to be 7 days to make sure that they don't have any onset symptoms. And so we've had some people take emergency paid sick leave for 7 days, or up to 5 days of payroll or whatnot. Or if they are experiencing symptoms, or they're waiting on a test and the doctor has written them out for 14 days, if it's past that threshold of yes, we have symptoms, yes, we're just waiting on a test result, then usually it's 14 days. So pay for the length of the medical advice, and it's up to 80 hours. The difference in between the FMLA is they basically expanded it from, originally it was 12 months. So FMLA was offered to employees that were actually on staff for 12 months or on payroll for 12 months. Now that's down to 30 days. So for emergency paid sick leave, you only have to work for 1 day. Emergency family medical leave expansion is 30 days or more. The employer pays 2/3 of the employee's pay or minimum wage, whichever is greater, going back to the $10 an hour example, for only reason 5. So only reason 5, which is childcare, is going to trigger the extension of the 10 weeks of FMLA. There's no pay for the first 2 weeks on that expanded family medical leave, and it's up to 10 weeks based on the childcare or until it is retained. I've got this in here as a hint, but require documentation or at least a weekly check-in. If anybody that's actually filing under or requesting for emergency paid leave under their child care provider not being available, we've actually had them check in with us at least once a week. Or we actually will call them and we'll say, hey, how's it going? What's going on? Just checking in. Are you still needing to, have you gotten or secured child care yet? And some have and some have not. But just a little tip there for you when you are having these conversations with your employees. The determination of full-time and part-time, now there's a lot of companies on here that are 20 or less. So if you have part-time employees or employees that work on an as-needed basis, and you need to figure out how to calculate their pay or how to calculate what to pay them on, like as far as up to the 80 hours, but on a regular work schedule, That's all given. They've got about 6 or 7 examples on the DOL's FAQ page. And when you all get these slides, all these have links to that's referenced. All right, so just to be clear, the first 2 weeks of reason number 5 are going to be still under the emergency paid sick leave, and then emergency family medical leave is going to be the last 10 weeks. So it's 12 weeks altogether that they're allowed to request, as long as you keep checking in and making sure that they don't have childcare, and require it in writing. There's some companies that are actually making forms for this kind of thing, to where they send the form on email or a fillable PDF format. The employee fills it out, says, no, I do not have anything, and then signs it and then sends it back. Okay. So there's a couple things that we need to know. We need to know that the federally required poster is required. This went out shortly before April 1st. If you have not posted that and you are an applicable employer that is required to post federal posters, then you need to have that up there if you haven't already gotten that up there. When you get these slides, that's the link to the actual poster. The requests start with the employee. So they need to bring it up to you, obviously, to what their grievance is, as far as, I do not have childcare available, or, hey, I just got notification that my wife is being directed to stay at home. The request starts with the employee. My suggestion would be to, have them, if you don't have a form already put together, go ahead and just have them shoot you an email with, this is what's going on, this is the explanation and whatnot, and this is why I need to, start my emergency paid leave. Use an emergency paid leave. Yeah, the request form there, I'm getting ahead of myself here, to maintain documentation for the IRS. The IRS in the beginning said that there's no documentation necessary. However, with further guidance, there's now starting to say that you should treat this just like any other FMLA or any other paid leave. So you would want to have something in writing. If you don't have a form, then you need to do the email. I've got some examples in a link gallery later in the slides, but so if you don't already have something like that put together, there's some examples in the end there that you can use, but definitely would suggest getting a form. It's a little bit more solid and universal, and that way you're doing equal treatment to all of your employees who request it. But just make sure that you get some kind of a documentation and a paper trail to show the IRS, because when you're at the end of the quarter, when you're getting your tax credit for this, they'll want to make sure that you're not taking advantage of the system. Now, like I said, initially, they said no documentation necessary, just have the documentation if we should ever audit. But now the DOL has given further guidance. Now we're getting to this point because they've gotten the IRS involved now, and we're here where we now will need, and anything with the DOL and IRS, always document, right? All right, so the employer has to be eligible for tax credits through the CARES Act. That's actually same parameters that the employers that are required to offer these. And it's through the less than 500 employees. And we're going to get into the employee exemption or employer exemptions here in just a minute. Document. I can't stress that enough. The ABCDE of HR is always be consistent and document everything. So make sure that everything that takes place, if it's a phone call and that you're not asking the employee to follow up with an email saying exactly what you just talked about, then document your phone call. Even if it's on a notepad and you put that in the employee's record. Just document. Even if it's a request that gets denied, we're documenting everything. So, all right. So the exemptions for the employees with less than 50. This one, this is just a snippet of what the IRS or the DOL language says. Basically, if it's a burden to the business, and basically the business can't afford to do it, but also the absence of the employee is going to leave the business in a bind because of their specialized skills or their responsibilities with the company, or if there are no other sufficient workforce available. You can actually show that as long as you document this part, you can actually show that and a lot of people on this call right now are 20 or less employees. So if if an employee comes to you and requests this, it's very important for you to document their request, but also to document your state and why why you're claiming exempt from this. Because if that employee were to ever, let's just say, go off and say, well, I asked for emergency paid sick leave and I was denied, you're going to have your documentation 6 months from now, 8 months from now in their employee records saying, yes, they came to me and asked for it. However, this is how many employees I have. I have 5. And this is the state of my financials at the time. I had 0 business coming in, or I was down to 10% of what I had before crisis, and I just couldn't afford to do it. Just have that documented in some way, shape, or form to where you're going to be able to cover CYA and the IRS, or the DOL if they came after you with the employee. All right, so exemptions, like I said, the guidance actually kind of leans on childcare on the reason number 5. This is the guidance on the DOL site, which probably all of you have visited by now. But basically, it leans on the childcare. However, further guidance on the FAQs with DOL will actually open it up to cover for emergency paid sick leave, all 5 or all of the 6 of the reasons there. There is no form to submit to the DOL for exemption. So like I said, you just got to document. Make sure that both transactions were documented, your request from the employee and also the situation and why you're filing or saying you're exempt from it. And when you get the slides, the guidance is there for that, but also this changes daily. And the bad thing about it is, if you've already been keeping up with this, it changes without notice, and they do not let you know of any changes. So in other words, any changes are not highlighted or separated, or there's no update summary. It is just changed. So literally having to read this every day just to make sure that there hasn't been any changes. But mainly a lot of the points and the concepts are set right now. But as they come across different situations, and different employers and employees with different scenarios, they may be adding some more, but a lot of the changes have slowed down this week. So, all right, so let's move over to OSHA. Anybody raise their hand for any questions or anything before we go into the OSHA side?
Haven't seen any. If anyone has any questions, you can unmute yourself and go ahead and ask your questions. So I did give you that option to unmute yourself.
All right, and so let's get into OSHA. So it's important to kind of keep compliant with OSHA as well while we're doing this. Everybody's harping on the general duty clause. This has always been in effect, and this is kind of OSHA's catch-all. And this helps us and also could possibly hurt us if, depending on your actions and what you're omitting and not doing or maybe doing. So this is why I kind of thought that this was important. So the general duty clause basically says that the employer is responsible to provide a healthy and safe workplace for the employee, free from recognized hazards. The recognized hazards is a clause that OSHA put in there because OSHA couldn't think of everything, and they also have a very lengthy, timely process to create new standards. Everybody's talking about PPE and masks. OSHA's been in existence since 1970, but we didn't have PPE guidance or standards until 2008. So if that tells you anything, we didn't have any PPE guidance that was set and standard until 2008. So there's a lot of stuff that goes into this, but also OSHA is able to go after certain complaints from employees based on recognized hazards. And they're considering COVID-19 a recognized hazard. So I just wanted to bring that up because that's where they kind of have the basis of that. So I want to kind of go through what the companies do. And I think I have some employers on this call that are in the industrial field. If so, this will be very familiar to you. Just to kind of cover the hierarchy of hazard controls, you've seen grocery stores put in things like plexiglass in between you and the cashier. These are called engineered controls. How can we manipulate the environment to protect the employees against the hazard? So you'll see, you see this all over the place now, and I think a lot of people have caught up with cashiers or face-to-face interactions for those companies that are essential and do not shut down. But start thinking about this in your own work environment too. What plexiglass or what kind of barriers can we put in place If you go to the post office, you see that they have plastic sheet and just enough room to push a box under if you're shipping a box. It's these kinds of things that OSHA will lean on as the hierarchy of control of how to prevent hazards from affecting your employees or harming your employees. So the first thing you do is engineer controls. You've seen a lot of that going around. The second step is administrative controls. And basically administrative controls are your work process. It's your policy. It's how you do the things that you do. It's how you actually do the work. I'll give you an example. We have people coming in to be dispatched to go to work. Our work process has changed a lot, where, we were one of the last holdouts of anybody that did face-to-face interviews right off the bat. Like anybody that came in and applied, we'd do a face-to-face interview. We'd get to know them. We'd get to know all their work history. Well, now all that's happening over the phone instead of face-to-face. And we still see the person, we still have them come in, but it's only when they have an assignment that we're about to place them on for dispatch to do the drug screen and things like that. And then you can only imagine what we're having to do a drug screen, or to have people come into the office. Like there's the whole gloves, mask, social distancing, the physical distancing there between you and the applicant or the potential employee. So administrative controls, make sure that, after you've put in the barriers and the engineered controls, go for the administrative controls. And then after that, then you go into the PPE. PPE has always been the last line of defense, okay? Gloves, masks, aprons, whatever you're going to be offering or providing or having your employees have access to make sure that they prevent the any contagion getting to them. So make sure that you do that in that order, because OSHA, when they come out, if they get a complaint or anything else like that, and not saying that you will, because a lot of these companies that are on the call, they're 20 or less, but OSHA has governance over anybody that has 3 employees or more, as long as you're not based out of your home. So just keep that in mind.
So Isaac,
yeah.
I have a question. So once you get down to number 3 with the PPE, do you think that's going to become a responsibility solely of the employer, or is there going to be some tax credits to help with the cost of PPE? When you're using these things every single day, the costs build up. So
yes.
How do you even incorporate that in a budget, and how do you afford that?
Right. So I'm actually going to, your question is perfectly timed. I'm about to get into that in the next couple of slides. So to answer that, I'm just going to get into this first one here with masks. For small employers, here's my suggestion, because it's in my bio, but I'm an OSHA Outreach instructor, which means that basically I do 1910 general industry training. We train a lot of our employees that go out to work in our industrial environments on a 10-hour OSHA course, and it covers a myriad of different things that they can use and knowledge to basically be more aware of the hazards in the workplace. So when I speak from this angle, this is what I'm speaking from as a trainer, or from this perspective. So a lot of my clients that are offices or have never done anything with PPE before, this is the guidance that I'm laying out for them too as well. So, all right, so PPE with masks. A lot of people are saying, they're putting up signs on the doors. You'll see them, at the post office, and I'm just using that because I just went the other day. They say that anybody coming into the building is required to wear a mask. My advice to you is not to require employees to wear a mask, and don't use the word mask. Mask and any kind of filters, air purifying filters, will require medical clearance, fit test, and training and everything else. And Tara, just like you said, there's a cost involved to that, and the employer is responsible for that cost. Do not use the word mask if you have not used that previously in your working environment. Now, I think some industrial clients, obviously they know this song and dance already. They're having to meet with that already, to meet those standards. But so do not use the word requiring mask, because it requires medical clearance, fit test, training, the whole 9 yards. It's also provided at the cost of the employer. You want to make sure that you can use the verbiage of requiring or permitting the use of and suggesting the wearing of face coverings. The CDC covers this as well on their website, and everybody's seen the flyer or the form going around saying, here's how to make a mask at home and stuff like that. It's actually not a mask, it's a face covering, which that's what I would suggest, to not open you up to the liability of the other requirements that come with requiring masks. So I'll give you an example. We actually have a notice or a memo, an advisory going out to our in-house employees pretty soon, because we're opening up our lobbies hopefully within the next month or so, about wearing face coverings. And so what we're doing is we're saying, you're permitted to wear these. We understand that face coverings are a part of your prevention from COVID, from getting COVID. And so, here's the guidelines, here's what we know, and here's the link to the CDC site, all that good stuff. So we're actually putting out that advisory, not making it mandatory and not making it required, because therefore, you would also have to meet everything else that OSHA requires. And just to give you an example, a dust mask requires a respirator fit test and medical clearance to be able to wear. So, there's a lot of people out there that don't know that. N95 mask has been talked about a lot. N95, N99s, dust masks are like a step below that. Is stuff that you would buy for a couple of bucks from Harbor Freight for, cutting the grass. The dust mask, if you require that in the work environment, that requires the respirator fit and everything else that goes with it. So be careful of your terminology when you create policies on requiring people and your employees to wear masks. Use the face coverings lingo, the terminology, and refer to the CDC site. That way you're not creating anything, you're not recreating the wheel, you don't have to, just refer to that. So that hopefully answers your question, Tara, is that, with a lot of these companies coming into this for the first time, be careful of your nomenclature. This is a workaround to also, provide, and we actually have masks here, but we're not saying you're required to wear it, just because of that point. All right. Yes, and like I said, you can use the notice to communicate the proper wearing and care, and then refer to that CDC website. All the good information is already made for you. You don't have to recreate the wheel. Just refer to those websites and your policies and your advisories, and you're good to go. Okay, gloves. A lot of companies, I've seen this with retailers, I've seen this at Costco and post office and stuff like that. If you require employees to use disposable latex or nitrile exam gloves, you got to make sure that it's provided by you, the employer. If you're requiring that is PPE that's provided at the cost of the employer. PPE training is necessary if you're going to require people to wear gloves. And also, if you're in one of those environments where you require people to wear masks or, face coverings, then provide the training as well. But you can do that within your advisory or your memo to the CDC website, and print out that document and staple it to it, or attach it to that email that you send out to your employees. PPE training is necessary when you require PPE. Oh, and then the other thing is that PPE requires a workplace hazard analysis to be done. So there's a whole slew of things that you're preventing by not requiring your employees to wear it. I hope that makes sense. And if anybody's got a question, just stop me in my tracks here if you do. Okay, so food and beverage, you're already kind of at this level already where you're having to use gloves for certain things. Stick to your guidelines that you have, because those match a lot of what OSHA already requires. And food and beverage is under the general industry arm of that OSHA. Just make sure that, that you're not having your employees bring their own gloves. Okay, an alternative to gloves, and this is that administrative work practices part. Post hand washing signs in the bathrooms, memos and routine cleaning and sanitization within the workplace, and washing your hands 8 to 10 times a day. That's part of our in-house advisory that we put out when this first came out through an email, and now we've got one that we've put into a form that's in the shape of an advisory saying, hey, this is what's going on. We all are aware. Here's what we're requiring in-house, and our suggestions and what we would, the work practices that we're changing. So an alternative to gloves. And actually, I think 2 of the stores that I've been to in the last week retail stores have, they're not requiring gloves, but you have hand sanitizer on the sides of each workstation. You've got signs everywhere that says, please wash your hands, don't touch your face, all this other good stuff. That's a good alternative to some of this PPE as well. All right, just keep in mind that training is required if you do require people to wear gloves. There's a lot of videos online. If you just Google on YouTube or search on YouTube that PPE training, some of the older videos are on there for free. You can send that web link to everybody. If you do the training and you are going to take this route, then keep the training logs when the employee with employee participation, as in they've signed in, date that they did it, and put it into your HRA records. Keep track of that training, because it's going to be important later on if you ever have to reflect back and say, well, no, we trained them on how to do this and how to wear this. We trained them on this and we showed them the video. They agreed that they saw it. They watched it. Just track all your training if you're going to require them to do that. All right, use what's available on the website. Like I said, refer. There's a really good one that I've got a link to here when you get the slides. The proper taking on and taking off, the donning and doffing of any PPE. And this is the proper way in bloodborne pathogen kind of process. The proper way to put on a mask, clean your hands, put on the mask, and then things to keep aware of, because obviously, and hopefully you all have seen this too, wearing a mask is not enough. There's a process that goes along with wearing a mask, surgical mask or dust mask, N95, no matter what, because we're still going up, touching this and whatever, and touching the mask. So be aware of that, but there's a really good document over there, and I've got the link to it here for the slides for you to use too. So share that with your employees if you're having employees wear PPE. All right, and then other things that you could be doing here, there's a really good bloodborne pathogen training, and like I said, there's a lot of free videos on YouTube. You don't have to spend the money to actually go out there and do the safety, get into the safety trainings. If you need help with any of this, reach out to me. I'll kind of walk you through some of the suggestions that I would have, what additional training to have. But bloodborne pathogens is a good one. That's required in most F&B and service and hospitality, as well as medical, for obvious reasons. But bloodborne pathogens fits right in line with what we're having to deal with a pandemic of the COVID level or the nature. So also CDC also has that in there. Like I said before, I keep coming back to this, but just refer them to that, or just have them. There's a PDF document of this on CDC website. Include that with that notice or memo to your employees. Okay. Raise your hands if you have any questions as we go through this. All right. So OSHA recordables. A lot of people have talked about this and what OSHA's guidance is on this. OSHA's record keeping rule only applies to the injuries and illnesses that happen in the workplace. So OSHA has made a determination that COVID, just like the avian flu and a couple of the other pandemics that we've had in the last 20 years, they've actually given guidance that it is considered an illness. So there's something else to consider here, because just because someone has symptoms doesn't mean you have to record it on your OSHA 300-day summary or your 300-day log. The only thing that goes on your log is if it is a positive test result for an employee. So it's very important to know that you don't have to actually log anything on your OSHA log unless it's a positive test. And that's OSHA's guidance on this. So yes, they do require that on the recordables, but it's only if you have a positive test. There's a lot of people out there that's getting tested and that's testing negative. So don't put that on your OSHA log unless they get a top positive test result. All right, so other employee protections, let's just kind of get into this a little bit. That was the employee being mindful about her surroundings and what's going on. Okay, so be careful of the following when you're actually managing employees. Age discrimination. The ADEA has been a big part of this. In the beginning, if you were to say single out employees because they were above the age of 60 or 70 and told them that, that they were to be laid off or you're the first to go, that's an age discrimination, and the EEOC will not look at that any different, no matter what kind of situation you're going through. So as you go through this in the next year, because, obviously we're going to have to be dealing with a lot of this in the next few months, but keep in mind that age discrimination with the COVID, just because they're higher risk, you need to be careful about how you approach that. The EEOC guidance, which I've included a link here, it gives you technical guidance on how to handle certain situations. So that's one thing to be mindful of when you're having conversations and when you're actually discussing, what to do with employees if they're, if you have somebody test positive. The first thing you do is don't send everybody home that's above the age of a certain age. Same thing with anybody with any immune system problems or anybody else that is at risk. If if somebody's very blatantly honest about their diabetes or their, or other health issues that are at risk or higher at risk for these, you need to do the same thing. You need to treat every employee the same, not to single out anyone. And this is your actions towards them. So obviously they can come to you and say, I'm not comfortable working, whatever, and then handle the situation like that. But just make sure that you're not singling anybody out just because of their high risk assumption. Discretion with health records. Anybody that's testing positive or getting tested and they show up on maybe a health record that you have privy to in HR or as an owner, be careful of that too as well. If they didn't tell you about it, then you can't ask them about it. If you can always ask about symptoms, it is okay to ask about symptoms. Have you had fever, whatever? And you've seen these things go out with questionnaires that companies are now using. It's okay to ask questions about symptoms and, have you had a fever in the last 12 hours, 48 hours? Have you done this and this and this? Have you been in contact with anybody that has tested positive? All those are fine to ask. You cannot say, well, did you test positive on that? Or what, you got your test result back? Okay. Avoid those kinds of conversations. That's private health information. All right. So, and any screening or questionnaires that you're doing, I've got a lot of manufacturing plants right now that are doing screening every day or at least once or twice a week that are asking their employees or having them fill out the form, sign the form, dated whatever for that day's log, and then they're taking those and putting them into their employee file. Just make sure that you're storing those correctly. That's not for general consumption. It's not for anything else, especially if you have questions or open-ended questions asking about an employee's health or diagnoses or test results or anything else like that. That may lead to that, or it may have information on that. Make sure that you're handling those documents correctly. Not to be shared with supervisors and management, only HR and anybody in the HR role, which would be owners. Most of you guys on the call, 20 or less employees, that would be you. Okay, so retaliation claims. Don't fire your employee because they say you're unsafe. You're not doing enough. You're not taking the right actions. Why haven't you gotten us masks? Why haven't you gotten us gloves? It has been made very clear by the Secretary of Prime Duty under the Department of Labor that any worker who believes that their employer is retaliating against them for reporting unsafe work conditions should contact OSHA immediately, because OSHA will follow suit with retaliation claim. It's the number one thing right now. It's not only with OSHA and workers, have being hurt on the job and then being terminated later. Retaliation claims are happening all over the field with FLSA and discriminatory reporting. Like you say, if you're reporting sexual harassment, then you get terminated for attendance a week later. Those kinds of things. You need to make sure that you're not retaliating against anybody that says that you're having an unsafe work environment. Not that anybody would, but I'm just putting it out there. Be careful of how you handle that. And if you do terminate somebody shortly after they've made a comment or made an official complaint, then make sure that you document very well on why and the reason why you've terminated them. Okay, there's one more thing here that is actually changing exempt employee statuses. And what I mean by that is non-exempt and exempt statuses. One thing that we need to be aware of is if you have exempt employees, employees that are salaried versus your non-exempt employees hourly, then you need to be careful of if you change any of their duties. And it's very unlikely, but a lot of things are going on. A lot of companies are doing things they've never done. They're putting people in different positions and acting as fast as we can to accommodate our clients and still provide a service and stay in business. So there's a lot of things that we're doing that we've never had to think about before. So one thing that is flagged is that you are considering your employees that are exempt and what makes them an exempt status employee, what qualifies for them, and making sure that you're not changing their duties to change that. I'll give you an example. Make sure you're not breaking that status. I'll give you an example like a restaurant manager. So let's just say you have a front of the house manager that's now running your drive-through, or that's now taking certain things like, I'm taking on-call orders and that's it. But you've assumed all the rest of the duties that manager has taken because there's not a lot of business going on. You're going to offload that onto yourself and then make sure that that manager or that front of the house manager is taking care of their duties. That could possibly change their exempt if they're salaried status. Now that's a loose example, but just so you have the understanding of be very mindful of, if you change the duties of your employees, that you don't change the duties to where it would break that exempt status, and you're misqualifying them or misclassifying them. Office managers turned receptionists is another one. All right. Okay, let's talk about employee screening. Any questions so far? Anybody raised hands or anything? Oh, please feel free to stop me if they do, Tara. Okay, so let's talk about screening employees. Now, a lot of people are doing this. If you've considered it or you're doing it now, there's a couple of things that you need to know. In a non-pandemic situation, measuring the body temperature or the employee's body temperature is a medical examination and is prohibited by ADA. During the pandemic, and let's just use the bird flu back in the day, in 2009, the EEOC gave guidance that during a virus pandemic, they're allowing employees to have temperature checks and to make sure, because again, general duty clause for OSHA, your job as an employer is to provide a safe and healthful workplace. And if you're allowing employees to come in with symptoms, then you are not doing enough. And that's an exaggerated example, but in 2009, the EEOC gave guidance on that, and they said that in specific situations like the bird flu and our current pandemic, it is allowed, and there is flexibility to do that. And actually, just recently on March 18th, they've updated that guidance, and there's a link to it if you ever need to resource back to it or resort back to that. That's the EEOC guidance as of March 18th, allowing us to do this in the COVID-19 timeframe. So as long as COVID-19 is there, we're allowed to scan temperatures. And as long as it is still a constant threat, we're allowed to do that. Now, you see these advertisements and you see these news coverage. Some companies are, like some of the chicken plants that are actually putting in this stand-up, digital body scanner. That kind of, I don't know where they're getting the guidance for that or how they're getting around that, but that's, keep that in mind and make sure you talk to your employment lawyer. But before you put anything that's in a fixed position where this is going to be here forever and ever, amen, thanks for installing it, and you're good to go. So just make sure you get guidance on that and make sure that you are meeting those qualifications to have that in your plan.
So Isaac, so basically until there's some resolution to COVID-19, a vaccine or
correct,
what have you, so we are able to do the body temperature. So let's use the chamber as an example. If we do get back to where social distancing is relaxed and we can have a chamber event, do I need to provide some disclaimer that they may be tested, their body temperature upon their arrival, or should I not go there?
Well, you can go there. Because it's your event that you're hosting. It's your, and even though a chamber is a nonprofit, I'll give you an example. One of the nonprofits that I led back in the day, I hosted an event. If anything happened in that event, it was on me. So as a chamber, if you're going to have hosting events and the COVID-19 has not come to resolution, no vaccine, we still have deaths from it. We still have uncontrollable, we still have to control our social distancing. You have every right to screen the participants of that. And you also have every right to post in the front of your business or in the front of your door saying that if you have, stop, if you have had any of these symptoms in the last, time frame, and there's an example that I've got in the link gallery that for a door, Fisher Phillips, the law firm there, they have a really good door poster that's already made up. All you gotta do is print it out, laminate it, and put it on the front door. But they, cause we built ours, but it's basically, we're gonna have to make a new one based off of Fisher Phillips's example when we open our lobbies back up. But to get back to your question, yes, you can screen the participants. You can screen people coming into your business. If you are open, if you've got an open lobby and you've got people coming in, you have every right to screen anybody coming through that door, because your job as an employer to your employees is to provide that safe and healthy workplace. And as a nonprofit chamber, well, you don't want your chamber members thinking that you're not doing enough. So it would be okay to do that. And it's not required by any means, but you would be in every right doing that. And employers, especially, if you are screening temps, this is allowed. Now, once this has surpassed, once we've passed the COVID, we need to be aware of that. We need to probably, be mindful of, what guidance comes out, because everybody will be made aware. If you're still taking temperatures during a non-pandemic period, that would be against their guidance. Okay. So also to include on that, the EEOC has recently confirmed that if an employer requires all employees to have a daily temperature check before entering the workplace, the employer may maintain a confidential log of that. And again, the documentation of any screening results, any of that information needs to be kept private and confidential and for eyes of HR and owners only, okay? All right, what if an employee tests positive? God forbid. Now, I hope nobody's had anybody tested positive lately, or within their ranks, but we've had one that has tested positive, but he's back at work now because he's gone through that was after everything happened. And we've also had some with spouses that have tested positive. What if an employee tests positive? What do you do? Well, an employer can share the diagnosis that they've had an employee test positive, but not the identity of the employee. And this is in the scenario that you do not have a disclosure. And I'm going to get down to that in just a minute. But if you do not have the employee sign off on a disclosure saying that you can alert the workforce, the rest of the workforce, of their positive test result, then you can share the result saying, hey, we've had someone test positive. Here's the action plan. Just not identifying the employee. The employer can let the workforce know that they've actually had somebody test positive. And usually that's done on email or by posting up something or handing it out. Remember, anything that's learned through the employee's health plan is protected health information. So if you have someone, or if you have access to something like that and you see, those things coming through, now you're not going to get a test result in your health plan information, but just knowing that they got tested is protected unless they come to you. All right, so be proactive. There is and again, this is actually from Fisher Phillips. They have a really good data bank there too with forms and templates. This is a link to that, and this is an authorization to disclose the diagnosis. So go ahead and do this now. Put something out on your letterhead that says, hey, I understand that I have rights. I understand that I don't have to agree to this. I understand that if I do agree to this, I'm doing so on my own free will, and it's all put in there in the disclosure. But also that I'm allowing you to share the diagnosis. And that way you're a little bit more freer to say, hey, this person in this work department tested positive. However, this is the action plan. We're going to keep the place clean, whatever, and go from there. Okay. It's not an optional thing. If you do have somebody test positive, you do need to let the rest of the workforce know. There's another template announcement for that. And there's a couple of different variations of templates that I've included in the end of the slideshow too as well. Okay, weathering the storm. So that's basically EEOC, everything else like that, OSHA, things that you need to keep in mind, things that I'm constantly having to kind of be mindful of when I'm talking to my clients, and we have a lot of people right now that are working. So, and also employees, when they call and ask questions, these are the kinds of things that we want to make sure we're mindful of. All right, so let's get into weathering the storm. And like I said in the beginning, this is my sharing my professional experience here as far as, with what we're doing with our businesses. And there's a lot of talk about, all of these things, and this is kind of a catch-all, and like I said, it's an information overload in the beginning. These slides and this recording will be there for you. So these are just some things that I've talked to about with clients, other friends in business, and things of that sort. Okay, local community banks really shine when it came through getting your SBA loans. If we've got anybody on the call today that has applied, apply again, use the same application, or some banks are just holding that application until they can resubmit you if new money comes along. Now, I've also heard of some companies and some business associates of mine has said, hey, I just got a notification. I just got approved. So there's still some things out there, but local banks, if you're going through like your big banks, and nothing against the big banks, but the local banks, and I think there was even a news coverage on this a while ago, but or like last week, where local community banks really came through and they really got, they did the work that was necessary to get their applicants in and get the loan money to them. So something to think about if you're using the big banks. And I'm sure Tara has a complete list of banks that are have been friendly, and she's been sharing that on her social media too as well through the chamber. Phase 4 is coming soon. To my knowledge, I don't think anything's been released. I checked this morning, and they're still kind of debating on different things. And now I think it's over $1 trillion instead of 350 billion. So, hopefully Phase 4 will be coming soon, and they'll restrict that to only small businesses.
And chambers.
And chambers, God, please. Yeah, because I know the chambers don't have access to that because of their 501 status. And Tara, I applaud you for holding together what you got and servicing your members. But yeah, everybody's feeling effects of this in all walks of business. Phase 4 is coming soon. Hopefully there's some more restrictions on bigger companies using this money so that it can benefit who it really needs to benefit, the people on this phone call. Also, if you don't have any SBA loans, I've talked to a few bank reps, and they are getting creative with some of their loans. Obviously, loans right now, and this is all over the place, personally and professionally, I think the interest rates are really great right now, but also I think some banks are getting creative in their terms for those that weren't able to apply or weren't able to get a SBA loan. So be sure to talk to your bank representatives about anything else they have going on. Not that it's just the SBA loans, but anything else they have, and tell them to get creative if they haven't, because they can. All right, so there's other methods. I don't know how familiar you are with this, but there is a payroll tax deferral. And this is especially beneficial if you have like over 10 or 15 employees, because this could equal up to like a couple of thousand a month of money into your pocket. But there is, there are dangers with any of these things that you take. The PPP loan was very attractive because of the loan forgiveness. These other options that are out there, like you have the EIDL loan that's always been there through the SBA. Now that money's dried up until they get more, but hopefully with Phase 4. But there's negatives to all of this. So there are payroll tax deferrals, and there's guidance on the IRS website for that. Basically, that you're allowing the applicable employers, anybody with less than 500, including your self-employed employers or your self-employed businesses, to defer payments of their portion of Social Security payroll tax between March 27th, when this came into effect, and December 31st through the end of the year. Now, there are dangers of this because, as any business owner knows, if you've got employees, you pay your payroll tax at the end of the quarter, and that's the way you run your business, and there's no ifs, ands, or buts to that. In this deferral, they're allowing you to defer that to the December of next year and the December of the following year of 2022. Now, if you are diligent and you are disciplined and you can defer your payments of that payroll tax to the government, and you are diligent about, if I use that for open cash flow to keep my business open, as long as I replace it later in that bank account or whatever that you've got to set aside for it, then do it. But if that's been an issue, or you've got somebody else handling this for you, and just be careful of that, because you don't want next December to come around and business to be slow and you're not able to pay that. So make sure that you do that. And Becky is on the call too as well, I think, from SME CPAs. So Becky, if you have anything else in addition you want to share while I'm going through this part, let me know. But yeah, so there is an option for payroll tax deferral. There is an important note here, though. If you do have emergency paid leave, like any of the paid sick leave or the FMLA expansion, obviously those will not, you can't take out additional or save out the additional, because you're getting that back anyway at the end of the quarter. All right, insurance claims. Everybody that's on the call that has insurance with, business insurance, there's a lot of talk going around about act of God language. Now, act of God language went out probably 10 years ago, 10, 15 years ago, I think, when they started kind of listing everything that is qualified under that, like storms, lightning strike, whatever, hurricanes, earthquakes. Each policy is different, but it's definitely worth a look. So you want to make sure that you contact your broker. If you've taken a loss of business, if you've taken, and who hasn't, if you haven't, then you're lucky. But who hasn't had a loss of that? Describe that in detail. Examine the language in your plan. Contact your broker who helped you get that plan or that insurance coverage, and talk it out with them. And then, if nothing else, just go ahead and file a claim. Get all your details together. Say, here's the loss of business that I've had. I haven't been able to get an SBA loan. This is what's going on. This is what I've lost. I've had to, whatever happened. And document all of that and put it in the claim. See what happens. And talk about it with your broker who got you that. And if you don't have a broker and you went straight through the insurance company, call the insurance company, have that conversation. I've talked to a few people that are doing this, and I've talked to two now that has had luck with it. They've gotten something out of that. So just, based on the verbiage and based on who you've got insurance with and things like that, just it's worth a try. All they can say is no. Okay, employee changes. All right, so I've got the open door there. We've all gone through employee changes in the last month and a half. So here's some things to kind of keep in mind. Pay attention how the employees react. In running a business, this is a test. This is a test on who's going to step up, who's going to be there, who's going to, go above and beyond, who's really going to shine, and who are you dependent on. And also keeping in mind, if you have employees that are a good fit, you want to make sure that they're maybe not a fit, if you have employees that are not a fit, or maybe that you've kind of been sitting on, you've been dependent on them because they come in at that weird hour that everybody else ignores or doesn't want to. Talk about this with your business partners or with your management team, or if it's just you, just take time to kind of think about this. I always use the GWC, and if you see my link source down there, it's with Gino Wickman's book, The Traction. But GWC, it's basically, now's a good time for your employees to be evaluated. And I know it sounds really weird, but I've actually had clients say, we've got to let go, but we're going to let go because this person has attendance issues, always, whatever. And they do that all the time. But, now it's really time to focus on how do we save money, or if we're going to have to cut people, who do we cut? So make sure that you actually think about the GWC is what Traction is, and Gino calls it in his book. But GWC is they got to get the job, they got to want to be there, and they've got to have the capacity to do the job. In addition to all that, do they meet the values of your company, the values that you've set place or that you exemplify? So something to think about while you've got this chaos going around you. Which employees are really shining, and which employees do you need to release? And people are being terminated in this pandemic. I will say that, people that are not doing their job right, not being productive, having attendance issues. Now, granted, attendance issues based on COVID is different, but I won't get into that.
Isaac.
Yeah.
I'm sorry. Can you give any clarification on, layoff versus furlough? Because furlough, the expectation is they will return to their job. Correct?
That's correct.
So if you furlough and then at some point decide that you don't want them back,
yeah.
What's the process at that point if you have not brought them back to work to lay them off? Or release them completely from your employee?
I understand that. And actually you're ahead of the game again still. So I'm actually going to have that come up in just a minute.
Okay, I'm sorry.
Versus layoffs. No, it's fine. You're on the right track, and you're on that same wavelength I was on when I was creating these slides. So you're going to have natural turnover, but like I said, you want to make sure that your toxic employees, and I say toxic, but get rid of them. Start building your dream team. There's a lot of people out there looking for work right now. The employment, the pool is open, and there's a lot of skill set out there. Where we were in a shortage 3 months ago and we were dying for skilled employees, there's a lot of people out there who are looking for work right now. And even though they're getting a lot on unemployment right now, if they have the Fed on top of what they're getting on the state, they're still gonna, the good employees will take a job to get off of unemployment. So make sure that you do that. Make sure that they're a culture fit with your company. Like I said, there's a lot of people out there who are looking for work right now, but also keep in mind, if you did get a PPP loan, you need to get back to the headcount that you were at prior to the crisis, at least up to 90% of it within that 8-week time frame. So the origination of the loan. Set aside an hour a week, and this is just what I would recommend. If you are in this situation, set about an hour a week aside to post your positions, review the candidates. You can do Zoom or video conferences. Leverage your local staffing agencies. There's a shameless plug. Let them do the work for you, because you don't pay anything until you hire someone. So use your staffing agencies and your employment agencies locally to do the work for you. Lean on the DOL. There's also posting on Facebook for free, and things that companies you may or may not know or be aware of, but Google and Facebook has set aside and earmarked millions of dollars in resources for advertising and boosting for small businesses. You'll see the links there. I've actually got links to those pages that they provide resources to. So if you want to boost a post of a job opening, you can do that through Facebook and apply for their grant. Pretty cool stuff there. All right, and as always, work your network. I tell people that are looking for work this. I'm going to tell people that are looking for employers. Always leverage your network, because people that you trust will always, 90% of the time, send you people that are good referrals.
Well, I'm going to leverage our network on this call right now. So if you have anyone that you think would be great chamber members that you'd like to refer,
there you go.
Send them to the chamber.
Currently taking new members. Unemployment, I'm just going to touch this and then I'm going to get into the furlough stuff. But basically, unemployment, Tara and I talked about this earlier. Georgia businesses, you have to file for your employees if it is COVID related. It's a partial claim. There's instructions on how to do that on the website. You're probably already having to do that or have already done that now. There's penalties in Georgia for not responding in a timely manner. So keep that in mind too. As in anybody that claims against your business for the rest of the calendar year will be able to be awarded benefits unless you appeal and go after it. So just be aware of that in Georgia. South Carolina claims, nothing's changed. The employee files, no matter what the reason is, and then you address those claims as they come in. Old employee claims are on the rise. Be aware of this, because as you get claims in, we're getting claims from people that have not worked for our companies since like 2017, 18, and 19. So we're getting old employees listing us as their employer to get unemployment benefits. But here's what they're doing. the Georgia Department of Labor and some of the South Carolina Department offices are actually asking them to list every employee that they can think of in the last 10 years. And they're sending the notice or the claim to all employees. So be aware of that. All of these require responses, especially if you're in Georgia, and especially, well, South Carolina has the same thing. You know, you have to respond, and it's always beneficial for you to respond. Just make sure that you don't take those lightly. And I was just talking to Tara about this earlier this morning. You're going to get a summary in. Make sure that your summary doesn't have anybody claiming against you that you appealed or that they determined that it was not going to be hitting your account. Okay. Well, I thought I had a layoff in there. We're going to get to it, Tara. I know it's in there. Okay. And I've only got a few minutes here left, but I'm going to go ahead and cover some of this. Minding the business and sales and support. Sales call, I mean, if you're getting sales calls, especially B2B, and there's a lot of B2B businesses on this call, I've heard complaints from my clients, and I've gotten my fair share of sales calls. Nothing wrong with that. Sales, I would be pushing my salesperson to go out and do that same thing. However, I would propose something a little different, to do something on the level of providing support. What can we do for you? You know, what kind of issues are you having right now? How can we help you guide that or navigate through this pandemic? Here's our services. Do you think, you know, whatever, or just here's my information. If you have any questions, let me know. Pick up the phone, call every one of your clients. It's, you know, sales versus support. Support is the biggest thing there. It's just like sales is sales, but education is the best sales part, right? What do you need? How can I help you? What are you going through right now? Who do you need to connect with? I know of an awesome chamber president that does this really well. Who do you need to do business with, or who do you need help from or service from? And can I help put you in touch with any of those people? Making the most of every interaction. If you've got clients calling in, make the most of every interaction. Once is not enough when you're doing this on your own accord. Call your clients, just checking in. Hey, you guys doing okay? You need anything? Whatever, you know, sales versus support. Less salesy, more support, and more there for you kind of thing. And there's a lot of good companies out there doing this really well. Call potential clients. You know, such and such is a client of mine, and this is what I'm doing for, you know, my client. It helped them out, or I wanted to make sure that you were taken care of in that aspect. Different kinds of things of that kind of mindset. Be the go-to person for your clients. And broaden your focus. If you're not getting enough business in your niche, Al Reese's book, Focus, I'm a big fan of that. And I'm going against his teachings right now, but you got to broaden your focus, go where the business is. If business is slow, how can you actually attain additional business or different kinds of business through expanding what you already do, or maybe altering your service? For example, distilleries, now there's no problems with the distilleries. They're still making alcohol, and alcohol sales are up. But they're making hand sanitizer too. People that are, you know, companies that are, you know, being there and supporting, but also benefiting from some of the spikes in what we need nowadays. I've seen a hair salon actually sell at-home kits. They'll have the tools and the whatever hairspray colors, you know, the color dye, like I need one of those, but dye color for your hair. In your at-home kits, and then offering to do a video walkthrough on how to do it. So just get creative. Who's still open and needs your help? How can you transform the value you provide into profit for now? I mean, a lot of us have taken a hit, and you've probably already crossed this this point, but just as a reminder, maintaining our business is number one. Maintaining and surviving is number one, and this may be another reason of how to do that. Other sources of income. This happens more than you think, but business owners have come to us and say, you know what? I've got 3 employees. The business is making just enough to make sure that they're paid. I'm not taking pay right now, but I need an additional source of income. I can work part-time, or I can work weekends while I manage my business. We're getting people in like that too as well. So just keep that in mind. Don't be too humble. It happens all the time. Even non-pandemic times. We always get, you know, the call to say, hey, this is what I'm going through. Do you think you can help? Or do you think you can find anything that might work around that? Stay on top of your collection, stay on top of aging and everything else like that. Show empathy by allowing payment plans or something like that to some of your loyal clients and steady clients. And keep in mind that those and they're not that they're going to share this with you, but PPP loans allow for certain expenses, qualifying under the 7A loans. So, and there's a link to those terms and those, what to use those for. And there's a list for the uses of the loans. I'm kind of speeding up here at the end there. Sorry, I'm just realizing I'm kind of taking up time there. Reduction of employee salaries. All right, Tara, this is getting to your question here. Okay, so you can reduce the pay of a non-exempt employee to reduce expenses. You just need to make sure that you're keeping it at minimum wage. That's the federal minimum wage, $7.25. Proper notice and acceptance would be ideal. If you're doing that, you need to make sure that you're documenting that. Your notice to drop the pay and why you're doing it. And if it's temporary, notating all of that. You can change the schedule of a non-exempt employee, but you must keep their pay the same. An exempt employee, but you must keep their pay the same. And a non-exempt, they get paid for every hour they work, so nothing changes with that. All right, Tara, to answer your question, layoffs. All right, so there's another good link to a form that is based on Traction, the book by Gino, about a reverse accountability chart. And this is actually determining what you need to be at a 50% reduction exercise. If you're having a hard time figuring out what employees to keep, this is a tool that you can use, as well as when you're making decisions on what positions to kind of cross over borders of other positions. All right, furlough versus layoff. Tara, I'm glad you asked about this. A furlough is basically an unpaid leave of absence, and you are still in a relationship of employer-employee. Now, the people that are on emergency paid sick leave or FMLA are still an employee of your company. They are just on a paid sick leave. They are still a W-2 employee. Anybody on a furlough is still a W-2 employee. They're just on an unpaid leave. So to furlough someone, and there's plenty of documentation out there for that. And if you need that, there's some in the links that I've got in this slide, but also if you need something beyond that, I'm more than happy to help you find it or give you some templates that we've got. Furloughs for documenting that and how to bring them back. And to get on the other question there too, Tara, is coming up. There's still a W-2 employee waiting to return. You cannot deduct pay from an exempt employee for business closures. So just keep that in mind. If you're having an exempt employee change their schedule or not work a certain day based on your decision, you just can't deduct their pay off of that. Some people are doing partials, reduction of hours. When an employer lays off an employee, it has ended or terminated their employment relationship, as in they are no longer a W-2 active employee of yours. They are to go to the DOL and file for unemployment or find another job. If you've been laid off, that's the difference. Furlough, you're still in a relationship. We're just in suspension right now. Separations while on FMLA leave, like I said, if you're on emergency paid sick leave, you are still an employee of the company. However, if the company has to have a layoff and you're out on leave, or you're out on a furlough or FMLA leave, extended or the expanded FMLA, if you're on paid sick leave and your position that you are in is eliminated with, like, say there's a department that's downsizing or being moved as, some people are being moved around or whatever the case scenario is. If you have people that have been terminated or let go because of reduction in force, and that employee that is on furlough, or that employee that is on FMLA, or that employee group that you furloughed, if it is going to happen to them, whether they were working there, if they had been working there, then you can terminate the employment. There's a proper way to do that. There's a proper way to document that. If you guys need help with that, definitely there's SHRM locally that can walk you through that. Your employment lawyer can walk you through that. There's tons of free resources out there that give you templates if you don't want to go through the expense of all of that. But there's also some links in there too that I've included. All right. So yes, document must be able to prove that the employee would have been laid off regardless of the FMLA leave, or if they're on furlough, or if you furloughed certain employees for whatever reason, you can, you need to document why they're a part of that group that's being terminated. All right. Over communicate, daily talks with employees. Make sure that you're being honest about where your company stands. You need to have calibrations on a daily level. We do this. We talk with our teams mostly throughout the morning time to figure out what's everybody doing. If you're working from home, here's your actions. What are you tackling today? Make sure you calibrate your daily actions list. Leverage your employees. Have think tank moments. Have Zoom calls where you're all on the phone and you're saying, hey, here's the client's problem. Here's what we've got to date, or here's what we've come up with. What else can we do, or what other solutions do we have? Your frontline concepts, people that are actually working on the front line. This has been proven many, many, many times. They might have a concept that you know how to put in place. So have those think tank moments. And a reminder, you cannot think of every solution. I've been reminded of this a lot in my years of, hey, here's my solution. Here's what we can do. And then someone that works for me says, hey, why don't we just do this? And it's a better idea. So make sure you are leveraging your employees that you have, especially after, they've stuck with you this long and through this pandemic. All right. Workplace safety policies. I'm just going to kind of go through this since I've kind of ran over time here. Guidelines for everyday hygiene, advisories, kind of what we talked about, PPE advisories, face coverings, that kind of thing. Update policies to accommodate. So if you have sick paid leave or leave that's already in a policy, you actually have some templates in this slide and with some of these web links that will give you examples of how to basically plug this in to cover the emergency paid leave given by the FFCRA. You need to document how these will interact with your existing policies. There's a link to some of the good templates that I found on Think HR. And remember about the policies about PPE. There's other things in the link gallery. Apps, these are just fun things that we've been using Slack for years now, but it's really come into play now that we've got people all over the place working at home, some are at the office. So Slack has been huge for us, and there's a link to the, and it's free. It's free. So even if you have 3 team members, you and 2 employees, or you and 2 other co-owners, this is excellent to keep in touch with, and this will replace your group text and stuff like that, and have a record of it. But the free version is very good. It's up to 10,000 messages for the free version. A lot of you guys are leaning on Google right now for your Google email. Use that G Suite. There's a lot of things in there like your docs, your drives, and stuff like that, and where you can collaborate with coworkers. And also Zoom, we're obviously using those a lot, but use those in the right way. Have team meetings, have your daily stand-ins on Zoom if you're working from home or if you've had remote workers. Here's that link gallery that I was telling you about. All the different resources that I was referring to, here's that again, and also the links throughout the slides. And final thought, we will get through this. I posted this a month ago. We will get past this. I understand that you guys are making a lot of tough decisions. Stay strong, just make the right decisions with the knowledge that you have now, and we will come out on top. We will survive all of this. Anybody that's on this call right now that's feeling the pinch, call out to me. Call me. I'll talk. I'll let you vent to me. I'll do whatever. Tara's there too as well. I've heard her do it myself. So I just want to thank you, and I'm sorry I ran over a little bit, Tara, but like I said, it was an information overload. There was a lot in there.
Thank you, Isaac. I want to thank you for that. Granted, it was a lot of information. The time was a little extensive, but that was great information. It was worth sitting through the entire presentation. So I thank you for providing that for us. And as soon as this link comes over with this recording, I'll make sure I share it with the folks that were on the call. So unless you have any last words, I'm gonna pause this in case there's something I need to bring back up, but pause the recording and then open it up. That way, if anyone else on the call would like to make any comments that's not necessarily gonna be a part of the recording, we can still have a few minutes of conversation before we actually close the meeting. So you're good? Thanks again, Isaac.